If your feet or hands ever feel like they're burning, buzzing, tingling, or prickling, I want you to pause for a moment and really pay attention, because this is not something you should brush off as just aging. I'm Dr. Christina Serrati, and over the years, I've worked with many adults over 60 who were told their nerve pain was something they simply had to live with. And every time I hear that, it deeply concerns me, because in many cases, that pain is not permanent, and it is not inevitable. In fact, I recently worked with a woman in her early 70s who came to me barely able to stand for more than a few minutes at a time. She described her feet as feeling like they were on fire, combined with sharp pins and needles that made even walking across a soft carpet feel unbearable. Nighttime was the worst. As soon as she lay down, the burning intensified, robbing her of sleep and draining her energy day after day. She had already seen multiple doctors. Her blood work looked normal. She was prescribed medications that dulled her mind but did nothing to fix the problem. One provider even told her, "This is just what happens when you get older." But here's what I want you to understand very clearly: chronic nerve pain is not a normal part of aging. It is usually a sign that something in the body is not being supported properly, especially when it comes to nerve nutrition. And today, I want to talk to you about one of the most overlooked nutritional deficiencies I see in people over 60, one that directly affects nerve function, nerve repair, and the protective coating around your nerves. Even more surprising? Many well-meaning doctors and supplement labels are pointing people toward the wrong form of this nutrient, which is why symptoms don't improve. Before I tell you exactly what that nutrient is, it's important to understand why nerve pain happens in the first place. Think of your nerves like electrical cables running throughout your body. Every message from your brain, to your feet, your hands, your muscles, travels through those cables. But just like electrical wires in your home, nerves need proper insulation to work safely and smoothly. That insulation is called myelin. When myelin is healthy, nerve signals travel cleanly and quietly. But when it breaks down, signals begin to misfire. That's when people experience burning sensations, tingling, numbness, sudden jolts of pain, or the feeling of walking on sharp objects when nothing is actually there. What most people don't realize is that myelin repair depends heavily on specific B vitamins, and if your body can properly use them, nerve pain becomes almost inevitable. In the next part, I'll explain which B vitamin is most critical for nerve protection, and why so many people are unknowingly taking a version their body can't use, straight from what I see in real patients every day. Now that you understand how nerve pain actually develops, let's talk about the one B vitamin your nerves depend on more than almost any other, and why so many people over 60 are unknowingly deficient even if they're taking supplements. That vitamin is folate, also known as vitamin B9. Folate plays a direct role in maintaining and repairing the myelin sheath, the protective coating that surrounds your nerves. Without enough usable folate, your nerves lose their insulation. Signals begin to leak, misfire, and spark, creating the burning, tingling, numbness, and stabbing sensations so many seniors describe. But here's where most people are being misled. When you walk into a pharmacy or grocery store and pick up a supplement, chances are the label doesn't say folate. It says folic acid. The names sound almost identical, which makes people assume they're the same thing, but biologically, they are very different. Folic acid is the synthetic, man-made version of folate. Your body cannot use it directly. It must first be converted into an active form before it can support nerve health. And here's the problem I see constantly in my practice: a large percentage of adults over 60 cannot efficiently convert folic acid into active folate. This isn't rare. It's not unusual. It's actually very common, especially with aging, digestive changes, and certain genetic variations. When this conversion doesn't happen properly, folic acid simply circulates in the bloodstream without doing the job your nerves desperately need it to do. It's like trying to unlock a door with a key that almost fits, but never quite turns. No matter how many times you try, the door stays closed. So people do everything right. They take their supplements daily. They eat fortified cereals and breads. They follow medical advice. Yet their nerve pain continues, or even worsens. And that's because their nerves are still starving for the active form of folate, the form that actually repairs myelin and supports nerve signaling. What makes this situation even more frustrating is that folic acid has been added to many common foods, breads, pastas, cereals, for decades. So someone can be consuming plenty of folic acid and still be functionally deficient in usable folate. This is why I see patients who tell me, my labs were normal, but I still feel awful. Standard blood tests don't always reveal whether folate is being properly activated inside the body. In the next part, I want to share a real patient story that mirrors what many of you are experiencing, and show you exactly what changed when we corrected this one hidden nutritional mistake. One of the most frustrating things I hear from patients suffering with nerve pain is this: my doctor said my blood work is normal, so they don't know why I'm hurting. If that's something you've been told, I want you to know, you're not imagining your symptoms, and you're not alone. The truth is, standard blood tests often fail to reveal functional nutrient deficiencies, especially when it comes to folate and nerve health. Here's why. Most routine lab tests measure how much folate, or folic acid, is floating around in your bloodstream. But they do not measure how well your body is actually using it. They don't tell us whether folic acid is being converted into its active form. And they don't show whether your nerves are getting what they need to repair damaged myelin. So on paper, everything may look fine, while inside your body, your nerves are struggling. I want to share the story of a patient who perfectly illustrates this problem. She was in her early 70s and had been living with severe burning in her feet for nearly 3 years. She described it as walking on hot coals mixed with needles. Sleep was nearly impossible. Every night, the sensations intensified the moment she lay still. She felt exhausted, discouraged, and increasingly isolated because she couldn't stand or walk for long. She had seen several doctors. Every test came back normal. She was prescribed medications that dulled the pain slightly but left her groggy and disconnected. One provider told her, "This is just part of getting older." But when she came to me, I asked her a different question: "What form of folate are you taking?" She pulled out her supplement bottle. Right there on the label, folic acid. She had been taking it faithfully for over 2 years, believing she was supporting her health. But her body couldn't use it. Once we switched her to the active form of folate, something remarkable happened. Within days, the burning began to soften. Within 2 weeks, the pain had dropped dramatically. She could stand in her kitchen again. She could sleep through the night. And for the first time in years, she felt hopeful. What changed? Not a new drug. Not an expensive treatment. Just giving her body the form of folate it could actually use. You see, nerve healing doesn't require force, it requires the right building blocks. When your body finally receives active folate, it can begin producing the compounds needed to rebuild nerve insulation and restore proper signaling. This is why some people notice improvement surprisingly fast. You're not masking symptoms, you're supporting repair. In the next part, I'll explain the exact biological process behind this repair and why active folate works so much faster than folic acid. To truly understand why switching to the correct form of folate can make such a dramatic difference, it helps to look at what's happening inside your body at the cellular level, without getting overly technical. Your body uses active folate to produce a critical compound involved in hundreds of internal processes. One of its most important jobs is supporting nerve repair and nerve insulation. Every nerve in your body is wrapped in a protective coating called myelin. This coating allows electrical signals to travel smoothly and efficiently from your brain to your hands, feet, and muscles. When myelin is strong, nerve communication is quiet and precise. When it's damaged, signals begin to leak and misfire. That misfiring is what creates sensations like burning feet at night, tingling or buzzing in the hands, sudden stabbing or electric shock pain, numbness that comes and goes. Here's the key point. Myelin cannot repair itself without enough active folate. When your body doesn't have access to usable folate, the repair process slows down or stops completely. Over time, the protective coating thins, cracks, and breaks apart. Your nerves become exposed and hypersensitive. They start sending pain signals even when there's no real injury. Now let's talk about why folic acid fails so many people. Folic acid must go through multiple conversion steps before it becomes active. In younger, healthier bodies, this process often works reasonably well. But as we age, those conversion pathways become less efficient. Digestive changes, medications, chronic inflammation, and genetics all interfere. So instead of being transformed into the form your nerves need, folic acid simply builds up unused. Meanwhile, your nerves continue to deteriorate. Active folate, often labeled as methylfolate or 5-MTHF, skips all of those conversion steps. It's immediately available for your cells to use. That's why results can appear much faster once the correct form is introduced. I often explain it this way to patients: if your roof is leaking, you don't need more buckets, you need materials to fix the roof. Pain medications are buckets. Active folate is the repair material. And this is why people often notice improvements in stages. First, nighttime burning becomes less intense. Then sleep improves. Then walking becomes easier. Over weeks, nerve signaling stabilizes and the pain continues to fade. This repair process doesn't require extreme doses or risky treatments. It requires consistency and the correct nutrient form. In the next part, I'll walk you through how quickly people typically notice changes, what early improvements look like, and what realistic expectations should be during the first 2 weeks. One of the most common questions I'm asked is, how soon should I expect to feel a difference? That's an important question, because understanding what real improvement looks like helps you stay consistent and avoid giving up too early. Overnight. But when you give your body the correct form of folate, changes often begin sooner than people expect. In the first few days, improvements are usually subtle. This doesn't mean nothing is happening. It means the repair process has begun beneath the surface. Many patients tell me that around day 4 or 5, they notice the burning isn't as sharp as it was before. The tingling may still be there, but it feels less aggressive, less overwhelming. Sleep is often the first major area of improvement. People who used to wake up multiple times a night because of burning feet or buzzing hands suddenly realize they're sleeping an extra hour or 2. They still feel sensations, but they don't dominate the night anymore. And better sleep alone can dramatically improve energy, mood, and pain tolerance. By the end of the first week, many patients tell me something interesting: I'm noticing the pain less. That doesn't always mean the pain is completely gone, it means it's no longer controlling their attention. That's an important milestone. When nerve signals calm down, your brain stops fixating on them. During the second week, improvements become more noticeable. Walking becomes easier. Standing in one place feels less uncomfortable. People stop planning their day around pain management. Simple activities, cooking, shopping, gardening, start feeling possible again. By day 10 to 14, many patients experience a significant drop in nerve discomfort, often between 40% and 70%. And by week 4, I commonly hear numbers closer to 60% to 80%. But here's something crucial I always emphasize: consistency matters more than dosage. Taking the correct form every single day is what allows nerve repair to continue. Skipping days interrupts the process. Think of it like physical therapy for your nerves: progress builds gradually through repetition. I also encourage patients to track their symptoms. Nothing complicated. Just rate your pain each day from 1 to 10. Write down how well you slept. Notice how long you can stand or walk without discomfort. These small observations help you see progress you might otherwise overlook. Another important point: improvement is rarely perfectly linear. Some days will feel better than others. That's normal. Healing nerves can be sensitive as they regenerate. Temporary fluctuations do not mean it isn't working. In the next part, I'll explain how much active folate is typically recommended, how to take it safely, and who should check with their doctor first. Now let's talk about the practical details: how much to take, how to take it, and whether it's safe, especially if you're over 60 or already taking medications. For nerve support, research and clinical experience both point to a daily dose of 800 to 1,000 micrograms of active folate as an effective starting range. This amount provides enough support for nerve repair without overwhelming the system. Some studies have used higher amounts, but I always recommend beginning at the lower end. Your body is very good at telling you what it needs when it's finally given the correct form. What matters most is the form, not just the number. When you're reading a supplement label, look specifically for methylfolate, L-methylfolate, 5-MTHF. These names all refer to the active form your body can use immediately. If the label says folic acid, it's best to put it back on the shelf. Take active folate once daily with food, ideally in the morning. Taking it with breakfast helps with absorption and makes it easier to remember as part of your routine. Food also reduces the chance of mild stomach discomfort, which is uncommon but possible in sensitive individuals. Now let's talk about safety. Active folate is a water-soluble vitamin, which means your body uses what it needs and eliminates the excess naturally. This makes it far safer than many over-the-counter pain medications people rely on for nerve pain. Unlike fat-soluble vitamins, active folate does not accumulate to toxic levels in healthy individuals. For most people, it is extremely well tolerated. However, there are a few important exceptions. If you are taking medications for seizure disorders, or if you are undergoing certain cancer treatments, folate metabolism can be affected. In those situations, it's important to speak with your healthcare provider before starting any folate supplement. For everyone else, active folate is often safer than long-term use of nerve pain medications, which can cause dizziness, fatigue, brain fog, weight gain, and balance issues. And here's something I believe every patient deserves to know: pain medications do not repair nerves. They only quiet the signals temporarily. Active folate works differently. It supports the underlying repair process, which is why improvements tend to last instead of fading as soon as the medication wears off. Many of my patients eventually find they can reduce their reliance on pain medications, but this should always be done carefully and gradually, under medical supervision. In the next part, I'll share 3 very specific signs that strongly suggest your nerve pain is linked to folate deficiency, and how to recognize them in your own body. At this point, you might be wondering, how do I know if this actually applies to me? That's a fair question, and the good news is, your body often gives very clear clues. Over the years, I've noticed 3 specific signs that strongly suggest nerve pain is connected to low active folate levels, especially in adults over 60. Let's go through them carefully. Sign number 1, your nerve pain is worse at night if your feet or hands burn, tingle, or throb more intensely when you lie down. This is one of the strongest indicators of B vitamin-related nerve dysfunction. During the day, movement and distractions help mask nerve signals. But at night, when the body is still and the nervous system quiets down, damaged nerves become far more noticeable. This is why so many people tell me they dread bedtime. They finally lie down, hoping to rest, and within minutes the burning starts. They shift positions, kick off the blankets, rub their feet, nothing helps. Sleep becomes fragmented, and exhaustion builds day after day. This nighttime pattern is extremely common in folate-related nerve irritation. Sign number 2, you've been taking folic acid, but nothing improved. This one surprises people the most. If you've been taking folic acid supplements or eating a diet high in fortified grains, and your nerve pain hasn't improved or has actually worsened, it may be because your body cannot convert folic acid into active folate. In some cases, unused folic acid can accumulate and interfere with how active folate works at the cellular level. That means even the small amount of active folate you get from food can't do its job properly. This is why some people say, I started taking supplements and somehow I feel worse. It's not your imagination, it's a form mismatch. Sign number 3, nerve pain plus fatigue, brain fog, or mood changes. Folate deficiency rarely affects just one system. Active folate is required to produce neurotransmitters that regulate mood, focus, motivation, and emotional balance. When levels are low, people often experience constant fatigue, difficulty concentrating, memory lapses, increased anxiety, or low mood. Many patients tell me they feared they were developing dementia because of how foggy they felt. But once active folate was restored, their clarity and energy returned along with nerve relief. When nerve pain, exhaustion, and mental cloudiness show up together, they're often pieces of the same nutritional puzzle. If you recognize even one of these signs, folate deficiency may be contributing to your symptoms. If you recognize 2 or all 3, there's a very strong likelihood it's playing a major role. In the next part, I'll explain exactly what to do, step by step, to test this safely and affordably, and how to know if it's working for you. If you've been listening closely and thinking, this sounds like me, I want to make things very clear: you do not need expensive tests, invasive procedures, or complicated protocols to see whether active folate can help your nerve pain. You can test this safely, simply, and affordably in just 2 weeks. Here's exactly how I guide my own patients. First, go to your local pharmacy or health food store and choose a supplement that contains active folate, not folic acid. Again, the label should say methylfolate, L-methylfolate, or 5-MTHF. Turn the bottle around and read the ingredients carefully. The wording matters. Choose a dose between 800 and 1000 micrograms per day. Once you have it, take 1 dose every morning with food. Make it part of your routine. Do not skip days. Consistency is what allows nerve repair to build momentum. Before you start, I recommend doing one simple thing: rate your nerve pain on a scale from 1 to 10. Write it down. Also note how well you're sleeping and which activities are difficult because of discomfort. Then begin your 2-week test. During the first several days, pay attention to subtle changes. You may notice the burning is less intense or doesn't last as long. You might fall asleep more easily or wake up fewer times during the night. These early shifts are signs that nerve signaling is beginning to stabilize. By the end of the second week, most people notice clearer improvements, less pain while walking, longer periods of comfort, and better overall energy. Some describe it as their nerves quieting down. This doesn't mean every symptom disappears instantly. It means your body has been given the correct raw materials to start repairing the damage. Now, let me be very honest with you. This is not a miracle cure. Nerve healing takes time. But when the underlying deficiency is addressed, improvement is not only possible, it's likely. What I love most about this approach is that it's low risk and low cost. We're talking about a supplement that typically costs less than a few dollars for a month's supply. Compare that to the ongoing expense and side effects of long-term nerve pain medications. I've watched people regain their sleep, their mobility, and their confidence simply by making this one correction. In the final part, I'll bring everything together: what this means for your long-term nerve health, when to reassess, and how to move forward with confidence. If there's one message I want you to take away from today, it's this: you do not have to accept nerve pain as your new normal. Too many people are told that burning, tingling, numbness, or electric-like pain is simply part of getting older. But in my clinical experience, that belief keeps people stuck, suffering unnecessarily, when their bodies are actually asking for support. Nerve pain is often a sign of nutritional breakdown, not irreversible damage. When your nerves don't have what they need to maintain and repair their protective coating, they begin to misfire. Signals get scrambled. Pain appears without injury. Sleep suffers. Energy drops. Quality of life slowly shrinks. But when you correct the deficiency, when you give your body the active form of folate it can actually use, you give your nervous system a chance to heal. I've seen patients return to activities they thought were gone forever. Gardening, cooking, walking comfortably, sleeping through the night, playing with grandchildren without wincing or constantly shifting position. And what often amazes them most is how simple the solution was, once they understood it. This isn't about chasing symptoms with stronger medications. It's about supporting the body's natural repair mechanisms. Active folate doesn't numb nerves, it nourishes them. As you move forward, remember this: healing is a process, not a race. Some people notice improvement quickly, others more gradually. What matters is consistency and patience. If after 2 weeks you notice even modest improvement, that's a powerful sign you're on the right path. Continue, track your progress, and give your nerves the time they need to rebuild. And if you're currently relying on pain medications, never stop them abruptly. Work with your healthcare provider as your symptoms improve. Many people find they need less support over time, but it should always be done safely. I also encourage you to listen to your body beyond pain alone. Improved sleep, clearer thinking, better mood, and steadier energy are all signs that your nervous system is becoming healthier. Before we close, let me say this from the heart: you deserve comfort. You deserve rest. You deserve a body that works with you, not against you. If this message resonated with you, consider sharing it with someone who may be silently struggling with nerve pain. Sometimes, the smallest piece of information can make the biggest difference in someone's life. Thank you for spending this time with me. If you found this helpful, make sure to subscribe to the channel and turn on the notification bell so you don't miss future videos where we break down simple, science-backed solutions for senior health. I'm Dr. Christina Serrati, and I'll see you in the next video. Until then, take care of your nerves, and take care of yourself.